You are watching Doctor TV Network. Physical examination.
This video presents examination of the head, including inspection of the head, hair, scalp, skull, and face. Examination of the eyes, including tests for visual acuity and visual fields, inspection of the eyes, and ophthalmoscopic examination. And examination of the ears, including inspection of the ears, otoscopic examination, and tests for hearing. In this video, the examiner will assess a healthy patient. Keep in mind that other patients may have the same normal findings or may exhibit normal variations or abnormal findings. Begin your examination with inspection of the head. Observe the size, shape, and position of the head, as well as its proportion to the neck and the rest of the body. Inspect the hair, noting its quantity, texture, distribution, and pattern of loss, if any. Part the hair in several areas to inspect the scalp.
Have you noticed any problems?
Observe for scaling, lumps, lesions, scars, and nits, or lice eggs, which are tiny white ovoid granules that adhere to hairs. Palpate the scalp and skull for masses and tenderness. When examining the patient's face, observe it at rest and during conversation. Also, assess the color and condition of the skin on the face. Look for skin lesions, scars, masses, edema, and unusual pigmentation for facial hair. Begin the eye examination by assessing the patient's visual acuity. To do this, have the patient stand 20 feet from a Snellen eye chart. If the patient wears contact lenses or general-purpose glasses, tell her to wear them. But ask the patient to remove reading glasses because they blur distance vision.
F, E,
Note the visual acuity printed at the side of the line of the eye chart.
Z, and D. Now I'd like you to try to read the next line. D, F.
Then repeat the test on the other eye. Remember to record visual acuity using two numbers, such as 20/20, which is normal.
E, and F.
Now prepare to test the patient's visual fields. Directly face the patient from a comfortable distance and imagine a glass bowl encircling the patient's head. Ask the patient to look into your eyes. As you return her gaze, place your hands 2 feet apart lateral to the patient's ears. Then, at ear level, move your wiggling fingers along the imaginary bowl until the patient points to them. Repeat these movements in the upper and lower temporal quadrants. Normally, a patient sees both sets of fingers at the same time. If so, the visual fields are usually normal. Note that the eyebrows normally limit the visual fields in the upper temporal quadrants compared to the lower temporal quadrants and the directly lateral areas.